So now we're switching gears to step 3, which is really talking about the setup, the sterile setup, and what you need to do with your assistants. And as we do this, you need to really understand your armamentarium. So implant motor, most important part of implant placement, really understanding the settings. So you're going to use your implant motor to drill for the implant bone grafting procedures. It allows you to do a variety of, you have hand pieces for a 1-to-1 hand piece. There are some endo hand pieces, but mainly we'll be using the contour angle hand piece that allows us to do dental surgery, basically implant placement, and then we have a 1-to-1 hand piece that's used more for sectioning teeth, doing bone reduction, etc. And for a surgical office, you will use this surgical motor all the time for implants. You can't really use any kind of a regular dental hand piece to do that. So the Surgic Pro from NSK really is a great kind of up-to-date, customizable type of implant motor. So you can adjust the torque anywhere from 5 Newton centimeters to 80, which is a really high amount of torque compared to other motors that stop at 50 or 55. You can have, on the 20-to-1, you can go up to 2,000 RPM. Most implant drilling protocols call for about 1,000 or 1,200. So you have plenty of flexibility there. And the 1-to-1 speed goes up to 40,000 RPM. So that would be used for reducing bone and things like that. We have all the different gear ratios that apply to oral surgery and endo. And it even comes now with an LED light that's pretty bright. So it definitely enhances the ability to see in addition to our surgical lights and loops. And the irrigation is very customizable. You have 5 different settings. You're not trying to roll a little roller up and down a line. You basically just press up or down on the button, and you can give yourself 5 different levels of irrigation, which is very nice. Foot controls, you've got a solution. You can control how much irrigation that you get. 5 levels. You can switch between different pre-programming, and you can decide whether you go forward or reverse. Then, of course, you can control the speed. So everything is hands-free. You don't have to touch it. You don't have to stop what you're doing to change the setting. It's ergonomic. It's not in the way. It's nice to have your presets. I usually have it set for a couple different main drilling settings and a couple main placement settings. But there are like 8 different settings, so you can really customize that well. And it's nice to not have to adjust the line, because that just gets in the way versus just giving yourself more or less irrigation. So here's just a brief video toggling through all the different settings. But typically, you're going to have most of those in memory under a program, and you just go back and forth. Another neat thing that you have is this calibration right here, so you can place a special driver into your implant motor and make sure that your torque values are calibrated. So you know exactly how much torque is coming out of the tip of the handpiece, which has been an issue on some of our older motors, where as they age, we're not sure when the implant motor stops, you're placing an implant, and you think you're at 40 Newton centimeters. On some of our older motors, we found that we thought we were going 40 Newton centimeters, but the motor is kind of worn out. So it's only pushing 30 Newton centimeters, but it's telling us it's doing 40. So hopefully you can see how that's kind of a big deal. And we've got all these different settings that we can go through.